Chest X-ray indications defined: pneumothorax, pleural effusion, hemothorax, pericardial effusion, cardiomegaly, MI, HF-CHF, consolidation, lung metastases, pneumonia, tuberculosis, sepsis, ARDS, lymphadenopathy, aspiration, COPD, hemoptysis, bronchiectasis, pulmonary oedema, URTI, RTI, CABG. Chest X-ray is one of the most common examinations in radiography. It is very helpful for the examination of the lung, heart, pleura, and some of the other structures of the thorax. Indications for chest X-ray may include symptoms such as chest pain, fever, persistent cough, shortness of breath, and others. Chest X-ray is very important examinations to examine chest conditions and pathologies. Some of them are discussed in the following slides. Pneumothorax. Pneumothorax is a condition where air leaks into the space between the lung and chest wall, known as pleural cavity. Pleural effusion. Pleural effusion is the accumulation of fluid in between the lung and chest wall, called the pleural cavity. Hemothorax. Hemothorax is the accumulation of blood in between the lung and chest wall, called the pleural cavity. Pericardial effusion. Pericardial effusion is the accumulation of fluid in the pericardial cavity. Cardiomegaly. Abnormal enlargement of the heart, MA. A myocardial infarction, MI, commonly known as a heart attack, occurs when blood flow decreases or stops in one of the coronary arteries of the heart, causing infarction, tissue death to the heart muscle. HF, CHF, heart failure, HF, also known as congestive heart failure, CHF, is a syndrome, a group of signs and symptoms caused by an impairment of the heart's blood pumping function. Consolidation. Consolidation refers to the alveolar air spaces being filled with fluid, cells, tissue, or other material. Lung metastases. Cancer that starts in one part of the body and spreads to the lungs is called lung metastases. Pneumonia. Pneumonia is inflammation of the lungs, usually caused by an infection. Tuberculosis. Tuberculosis, TB, is a potentially fatal and contagious disease caused by the bacterium Mycobacterium tuberculosis. ARDS, acute respiratory distress syndrome, ARDS, is a serious lung condition that causes low blood oxygen. This is because of fluid buildup in alveoli. Sepsis. Sepsis is a serious complication of an infection. Upper respiratory tract infection, LRTI, lower respiratory tract infection, CABG, coronary artery bypass graft, lymphadenopathy, a disease affecting the lymph nodes. Aspiration. Aspiration is when something enters the airway or lungs by accident. It may be food, liquid, or some other material. COPD. Chronic obstructive pulmonary disease refers to a group of diseases that cause airflow blockage and breathing-related problems. Haemoptysis. Haemoptysis is the medical term for coughing up blood from the lungs or bronchial tubes. Bronchiectasis. Bronchiectasis is a chronic lung condition where the walls of your airways, bronchi, widen and are thickened from inflammation and infection. Pulmonary oedema. Pulmonary oedema is a condition in which too much fluid accumulates in the lungs, interfering with a person's ability to breathe normally. Thank you.